Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the blood supply and nerve supply of the oral cavity. Let's start with the arterial supply, then we'll go to the venous drainage, then we'll deal with the nervous system or innervation of the oral cavity. The blood supply of the oral cavity is primarily provided by branches of the external carotid artery which include the maxillary artery. It also includes the facial artery and the lingual artery. The maxillary artery is a terminal branch of the external carotid artery. It has multiple branches like inferior alveolar artery, supplies the mandibular teeth. It enters the mandible through the mandibular foramen and comes out anteriorly by the mental foramen as mental artery. Buccal artery supplies the buccinator muscle and cheek. Infraorbital artery, all are branches of maxillary artery, supplies the maxillary teeth via anterior and middle superior alveolar arteries. Greater palatine artery supplies the hard palate. Lesser palatine artery supplies the soft palate. Sphenopalatine artery supplies the nasal cavity and anastomosis with the greater palatine artery via the incisive foramen. So we got the external carotid artery, maxillary artery, then facial artery. It has two branches. Superior labial artery supplies the upper lip at anterior maxillary gingiva. Inferior labial artery supplies the lower lip and mandibular gingiva. Lingual artery has three branches. Dorsal lingual artery supplies the posterior part of the tongue. Deep lingual artery supplies the anterior part of the tongue. Sublingual artery supplies the floor of the mouth and sublingual gland. Okay, so we are looking at the blood supply, external carotid artery. It is branched lingual artery, facial artery. Okay, and this is the terminal branch, superficial temporal maxillary. From the maxillary artery, we are getting the inferior alveolar artery here. From the maxillary artery, we're also getting buccal artery, and we'll get the the inferior artery becomes the mental artery at mental foramen. From the maxillary artery, we're also getting infraorbital artery that supplies this part. Okay, so regarding the venous drainage, we have the veins corresponding with that of the arteries, like the deep facial vein. We have that, and ultimately here is the pterygoid plexus of vein in the infratemporal fossa. This infraorbital vein here, and all of them ultimately goes to the internal jugular vein. Okay, we are saying that the inferior alveolar artery and vein in the mandibular canal. Mandibular canal begins from the mandibular foramen. It goes to the body of the mandible and comes out to the mental foramen as mental artery and vein here. This supplies the lower lip and drain the venous blood. It supplies the lower teeth and also venous drainage from the lower teeth, lower jaw teeth. Okay, we got that. From the upper, for the upper jaw, we're getting the posterior superior alveolar artery and vein. And we have the anterior superior alveolar artery and vein. Here we have the venous drainage corresponding veins, including the facial vein, pterygoid venous plexus, and lingual veins, drain the oral cavity. These veins eventually drain into the internal jugular vein. Okay, blood supply and nerve supply of the palate. We have the greater palatine artery here and gyrapalatal nerve. And we have the lesser palatal artery, lesser palatal nerve for the soft palate, for the hard palate. These are the gyrapalatal nerve, gyrapalatal artery. And for the incisive canal, we're getting also the nasopalatal artery is anastomosing with the gyrapalatal artery. Also, we're getting the nasopalatal nerve here. Okay. We have multiple nerves supplies the oral cavity like that of the lingual nerve. We have the glossopharyngeal nerve. Glossopharyngeal nerve particularly it supplies a muscle called stylopharyngeus muscle. It also picks up sensation from the oropharynx and also posterior one part of the tongue, both sensory and spatial sensation taste from the posterior one part of the tongue. And this is the lingual artery, and this is the lingual vein here. Okay, we got that lingual artery, lingual vein, we got that. And lingual artery has three branches: dorsal lingual artery, then we have the deep lingual artery, and the sublingual artery. That branch has not been shown here properly. Okay, so we got that. And regarding the nerve supply, if we go there again, okay, so here we got the nerve, the lingual nerve. Lingual nerve is also getting the contribution from chorotympanic nerve for spatial sensation. Okay, lingual nerve is a branch of the mandibular nerve. We have the glossopharyngeal nerve, there is the 9th cranial nerve, hypoglossal nerve, 12th cranial nerve. Hypoglossal nerve supplies all the muscles of the tongue except the palatoglossus. Glossopharyngeal nerve supplies the stylopharyngeus muscle. Okay, so this is the nerve supply of the tongue, anterior two-third general sensation and by the lingual nerve. That is the branch of the mandibular nerve. Special sensation of taste via the choroid tympani nerve. Okay, that is carried by the lingual nerve. Posterior one-third of the pharynx will get inner sensation, both taste and general sensation, except the velar papillae. Velar papillae is actually including the velar papillae for the posterior one-third of the tongue that is carried by the glossopharyngeal nerve. Anterior two-third except velar papillae carried by the taste sensation is carried by the choroid tympani branch of the facial nerve. Posterior one-third of the tongue, the taste and general sensation carried by the glossopharyngeal. Hypoglossal nerve supplies all the muscles of the tongue except the palatoglossus, which is innervated by the vagus nerve. Okay, we are saying the nerve. This is the maxillary division of trigeminal nerve. Optional division does not supply. This is the maxillary division, mandibular division. Mandibular division has also, this is the branch, lingual branch. This is the inferior alveolar nerve, passes along the inferior alveolar artery and vein, and they pick up sensation from the teeth. Okay, and terminal part becomes the mental nerve that picks up sensation from the skin and gingiva over this area. Okay, so we got again the maxillary nerve supplies the upper teeth here via the posterior superior alveolar nerve, middle superior alveolar nerve, and the anterior alveolar nerve. Okay, from the mandibular division, we have the lingual nerve and the inferior alveolar nerve. For the hard palate, we'll get the getaplatin nerve, getaplatin artery. For the soft palate, lesser platin artery, lesser platin nerve. Okay, we got the getaplatin artery with the lesser platin artery and nerve. Here also artery and nerve. Nerves of the oral cavity, multiple nerves innervates the oral cavity. General sensory innervation is carried by predominantly by branches of the trigeminal nerve, particularly the V1, particularly the V2, not V1, V2 that is the maxillary nerve, and V3 that is the mandibular nerve. Upper part of the oral cavity, including the palate and upper teeth, are innervated by the branches of the maxillary nerve. Lower parts, including the teeth and oral part of the tongue, are innervated by the branches of the mandibular nerve. Taste sensation from the oral part or anterior tooth of the tongue, except the palate papillae, is carried by the branches of the facial nerve, which joins and are distributed with the branches of the trigeminal nerve. Parasympathetic fiber to the gland within the oral cavity are also carried by branches of the facial nerve, which are distributed with the branches of the trigeminal nerve. Sympathetic fibers in the oral cavity ultimately comes from the spinal cord level 1, from the gray horn, synapses in the superior cervical sympathetic ganglion, and are eventually distributed to the oral cavity along the branches of the trigeminal nerve or directly along the blood vessels. So sympathetic fiber can follow anything. It may go over the artery. It may reach to the target directly. Usually it goes along with an artery in the wall of the outer wall of the artery. All muscles of the tongue are innervated by the hypoglossal nerve except the palatoglossus, which is innervated by the vagus nerve. All muscles of the soft palate are innervated by the vagus nerve except for the tensor veli palatini, which is innervated by the branch from the mandibular nerve. The muscle, that is mylohyoid, that forms the floor of the oral cavity, is innervated by the mandibular nerve. Okay. Oral cavity's nerve supply is primarily from branches of the trigeminal nerve. This is sensory. Okay, cranial nerve, including the maxillary, V2, and mandibular divisions. Maxillary nerve division to V2, greater palatine nerve supplies the hard palate. Lesser palatine nerve supplies the soft palate. Nasopalatine nerve supplies the anterior hard palate. Posterior supraalveolar nerve supplies the maxillary molar teeth and buccal gingiva. Infraorbital nerve supplies the maxillary, anterior teeth, upper lip, and the cheek. Mandibular division, it innervates, actually it is sensory, it picks up sensation via the inferior alveolar nerve. It picks up sensation from the mandibular teeth and mental region via the mental nerve. Okay, this supply is for picking sensation. It is sensory. Lingual nerve supplies the anterior two-thirds of the tongue, that is also general sensation. So we can say this nerve carries sensation. Buccal nerve, it carries sensation from buccal gingiva and cheek. Glossopharyngeal nerve provides sensory innervation to the posterior one-third of the tongue and oropharynx, including the palatine tonsil. Facial nerve, cranial nerve, nerve 7 supplies taste sensation. We can call it, it pick up taste sensation to the anterior from the anterior two-thirds of the tongue near the chorotympani nerve, which joins the lingual nerve. Lingual nerve is just a conduit for the chorotympani branch of facial or vehicle for the chorotympani branch of the facial nerve, which carry taste sensation from anterior two-thirds of the tongue except the velvet papillae. Hypoglossal nerve is the motor supply to the muscles of the tongue, supplies all the muscles of the tongue except the palatoglossus, which is supplied by the vagus nerve. And that's all about blood supply and nerve supply of the oral cavity, the tongue, the hard palate, soft palate, gum. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.